Taxes may need to rise to historically high levels in order to give the NHS the money it needs to cope with an ageing population. That's according to a new report by top economists today.
It concludes that UK spending on healthcare will have to go up by as much as £2,000 per household over the next 15 years in order to avoid a decade of misery in which the old, sick and vulnerable are let down. Dr. Hilary, that's going to be quite a shocking statistic for people to be waking up to this morning. £2,000 per household.
It's a huge rise, historically much bigger than we've seen for many, many years. And actually, it's due, it's overdue. The Institute for Fiscal Studies has looked at the provision of healthcare, both social care and for the NHS, and they say that unless we do something, we can't even maintain the crisis level that we're in at the moment. We've got a crisis in general practice, we've got a crisis in accident and emergency, we've got bed blocking, we've got an ageing population with increasingly complex needs, and we just can't maintain services at the current levels of healthcare provision. So something needs to be done, not just short-term injections of cash to help with the crisis here and there, but a long-term funding solution. And I think the Prime Minister has acknowledged that, but how are we going to do it? It's either going to come from tax, or it's going to come from national insurance, or it's going to come from VAT, but it's got to come from some source, and it's going to hit households. If they want a good health service and they want to be secure and safe in hospital or in general practice, someone has to pay for it. And it's no longer saying, oh, but it's not just a question of money. It absolutely is.
I mean, traditionally, Hilary, as soon as anybody suggests raising taxes or a specific tax, there's an outcry and people will say the Tories want to privatise the NHS, and that's going to be the big resistance to this, isn't it?
Well, no, this wouldn't be privatisation. This would come from people's taxation or national insurance, excuse me.
Would it be identified specifically for the NHS, though?
Well,
or would... You know, that's the problem, isn't it? I think people don't mind the idea. Some of the people we've talked to said, OK, but others are like, well, hang on, is this just the beginning of more and more taxing?
There's an overwhelming feeling that if people knew that their taxation increase was going to the NHS, they would welcome it, certainly wouldn't mind it as much as a general increase in taxation where we didn't know where the tax was going. The NHS is beloved by the nation, and quite rightly. And if people said, yeah, I know it's going to hospitals, I know it's going into general practice, great, I don't mind paying for that because it protects us all. If you could ring-fence it like that, people would be more willing to stump up some tax or NIC. But I don't think it's easy to do that. I'm told by politicians and by Institute of Fiscal Studies, it's very difficult to ring-fence taxation for any particular cause because you can't identify where it goes. But if you could do that, and if you had, say, an NHS lottery that was only going to go and help the NHS, then I think people would play the lottery more. But no one seems to have the imagination or the creativity in Parliament to be able to do these things, and I wonder why.